In medical rounds, Hartford Hospital is the first in New England to implant a new extravascular defibrillator to treat patients with abnormal heart rhythms. Joining us is Hartford HealthCare's Dr. Zweibel to tell us more about this. Thank you for being with us.
Thank you for having me, Caitlin. I appreciate it.
So first, tell us about this device. What is it?
So the extravascular ICD is an implantable cardioverter defibrillator. These are devices that are implanted in patients who have had very dangerous or at risk of having very dangerous heart rhythm problems. The traditional ICD is implanted through blood vessels in the chest with a device sitting under the skin and the wires for the defibrillator sitting inside the blood vessels and in the heart. And the extravascular ICD is a novel ICD where the lead or the wire for the defibrillator, instead of sitting inside of the blood vessels, actually is placed underneath the breastbone or the sternum of the patient, and the device is actually put on their left side. It basically operates very similarly to a regular intravascular ICD, but has the benefit of not being inside of the blood vessels.
Interesting. Tell us a little bit about the procedure and who might qualify for it.
Sure. So patients who would qualify for this would be those who, as I said, either have had a life-threatening heart rhythm problem or are at risk for having them. The device is done in our electrophysiology laboratory at Hartford Hospital. The wire is actually placed underneath the breastbone. It's a procedure that takes about 45 minutes to an hour from start to finish. And afterwards, the patients actually recover and go home the same day.
And can you tell us a little bit about some of the benefits, perhaps compared to the more traditional ICDs?
Sure. So some of the issues we have with traditional ICDs that go through blood vessels in the heart is that some of the complications that we have from these procedures, both short and long term, have to do with those wires having to live inside of our bodies. And so the extravascular ICD, since it's not going inside of the blood vessels or inside the heart, we expect to have many less complications. And the benefit of this device over existing other devices that can be put underneath the skin as well is the fact that the device is much smaller, the battery lasts longer, and it can actually treat heart rhythms by not only giving the heart a shock, but also by pacing the heart rapidly. So we feel that this device will be very appropriate for a lot of our patients who require ICD therapy.
Doctor, thank you so much for the information and your time. We do appreciate it.
Sure.
And if you'd like some more information, you can visit hartfordhealthcare.org/heart.